Let's get right into it today. We're taking a deep dive into cat bite abscesses.
Always a fun one.
The classic scenario. Busy day at the clinic, and in walks a worried owner with their cat. And what's that? Oh, yeah, painful swelling.
A tale as old as time. Happens all the time in practice, especially I feel like when the weather gets warmer and the cats are out roaming around more.
So our sources are really diving deep into what makes a cat bite abscess, well, a cat bite abscess, and not just your average wound.
Yeah, and it comes down to what's going on, like, under the skin.
So really, what is it that makes a cat bite abscess different from just a normal wound?
So you know how a cat's mouth, it's like teeming with bacteria? Well, those teeth, when they sink in, they're like injecting this cocktail of microbes straight into the tissue.
Oh, lovely.
Yeah, and it's not pretty. Those bacteria that just start multiplying like crazy in this little pocket, and bam, you've got an abscess. It's like a bacterial invasion.
Our sources specifically mention Pastorella multicida as a major player in all of this. So why is Pastorella such a big deal when it comes to these cat bites?
Well, you see, Pastorella, it just loves these low oxygen environments. A puncture wound, that's like a 5-star hotel for them. So they can turn a little bite into a serious infection, like super fast.
Wow, that's so good. And to make things even more complicated, it's not always just one type of bacteria, right?
Right. You can have a whole mix in there. Sometimes it's Pastorella, sometimes it's staph, and then you've got those anaerobes to deal with too.
Anaerobes?
Yeah, those are the ones that can survive without oxygen. Talk about a tough enemy.
Sounds tricky. So we've got this hidden enemy multiplying and causing all sorts of trouble. What should we be looking for in our initial exam?
Well, sometimes it's pretty obvious. You'll see the swelling, maybe some discharge. The cat might have a fever or be acting lethargic.
Seems pretty straightforward. But I imagine it's not always that clear-cut.
You're right. Sometimes those abscesses can be pretty sneaky. They like to hide deep in the tissues. Think armpits or the groin.
And couldn't it feel a lot like cellulitis in the early stages?
Oh, absolutely. Early on, it can be really tough to tell them apart. I've always found that paying close attention to the cat's history can really help, though. If there's a known bite wound, even if it seems minor, I always keep an abscess in mind.
That makes sense. So a good history is key. What if the owner isn't even aware that their cat was in a fight? Cats are pretty good at hiding their injuries, after all.
True, sometimes those clues are really subtle. Maybe the owner notices the cat licking or grooming a specific area more than usual, or the cat might be a bit more withdrawn. Any change in behavior, especially after being outdoors, is a red flag for me.
So it's a bit like detective work, putting all those pieces together to make the diagnosis. But let's say we strongly suspect an abscess. What diagnostic tools can help us confirm it?
Well, aside from a thorough physical exam, aspirate cytology is our go-to.
So basically we stick a needle into that swollen area?
Basically, yeah. And it's amazing what you can learn from that little sample of fluid. We look at it under a microscope, identify the white blood cells and bacteria, and bam, we've got a definitive diagnosis.
Okay, so aspirate cytology paints a clear picture of what's going on inside that abscess. Now, our sources also mention radiographs. When would you want to do those?
Yeah, radiographs are helpful when we're worried about deeper structures, especially bones. So think about those bites that happen on the limbs. If you see any lameness, swelling around the bone, or the abscess isn't responding to treatment as it should, an X-ray can help us rule out osteomyelitis.
Which is definitely something you don't want to miss. Our sources also emphasize that things can go downhill pretty quickly if these abscesses aren't treated properly.
No kidding. We're talking cellulitis, where the infection spreads beyond the initial abscess. I've even seen cases where it's progressed to involve a whole limb. And then in severe cases, you can get tissue necrosis.
Tissue necrosis, that sounds scary.
It is. It's basically when the infected tissue starts to die.
Okay, so early intervention is key. But what about other complications our sources mentioned, like osteomyelitis and sepsis?
Those are definitely worst-case scenarios, but they can happen, especially if the infection isn't treated or if it's just really aggressive.
And those are really tough to deal with.
It's definitely not something you want to see. Osteomyelitis, the bone infection, that can take months of antibiotics and even surgery sometimes. And sepsis, well, that's a whole other beast. It's a systemic inflammatory response that can be life-threatening.
Okay, so these abscesses, while seemingly common, can have some serious consequences. Before we jump into treatment strategies, let's talk about something that often comes up with cat bites, FIV.
Right. FIV, or feline immunodeficiency virus, a big concern, especially with bite wounds.
So testing for FIV and FELIV is crucial in these cases.
Absolutely. It's not just about the abscess, it's about understanding the long-term implications for the cat's health. And it's a great opportunity to educate owners about FIV and what it means for their cat.
Speaking of testing, our sources also recommend considering bacterial culture and susceptibility testing. When would you opt for that?
Culture and sensitivity testing can be a real lifesaver, especially in those cases that just aren't responding to the initial antibiotics. It helps us figure out exactly which bacteria are causing the problem and which antibiotics are going to be most effective.
So it's like a personalized treatment plan.
Exactly. Sometimes, especially for those really deep abscesses, it makes all the difference.
So we've covered understanding those pesky bacteria, recognizing the clinical signs, and using our diagnostic tools. Now, let's tackle treatment. What do our sources recommend for taking on these infections?
Well, the gold standard is a two-pronged approach: surgical drainage and antibiotics.
Makes sense. Let's start with the surgical side.
Mhm.
What are the key things to keep in mind for draining these abscesses effectively?
Well, the goal is to get all that purulent material out and create an open wound that can drain. So we actually want to avoid primary closure, meaning stitching the wound closed.
Why is that? It
Hmm.
seems counterintuitive to leave a wound open.
It might, but you have to remember those anaerobic bacteria we talked about. They thrive in closed spaces with low oxygen. So by leaving the wound open, we essentially force them out into the open air where they can't survive. Plus, it allows for continuous drainage and prevents those bacteria from getting trapped.
Ah, so it's all about creating an environment that's inhospitable to those bacteria.
Mm.
Now, what about those abscesses in the axillary and inguinal regions? They always seem to be more complicated.
Oh, absolutely. Those areas are tricky because of the loose skin and all that subcutaneous tissue. The abscesses can really burrow deep and become extensive. It's like trying to drain a swamp sometimes.
Yikes. So how do you approach those cases?
Meticulous surgical exploration and debridement are key. We need to make sure we get into all those nooks and crannies, remove any necrotic tissue, and flush the area really well. Sometimes a Penrose drain is necessary to help with continued drainage, too.
It sounds like surgical drainage is a lot more involved than just a simple incision and drainage.
It definitely is. It's about creating an environment that promotes healing and prevents those bacteria from taking hold again. And sometimes, despite our best efforts, these abscesses can be really tough. In those cases, it's important to know when to call in a surgical specialist.
That's a good point. It's just as important to know our limitations as it is to know how to handle things ourselves. But surgical drainage is only part of the equation, right?
Oh.
Let's talk about antibiotics. What do our sources say about choosing the right antibiotics and how long to use them?
Well, when it comes to antibiotics, we want to choose something that will target those common culprits we discussed earlier. Amoxicillin with clavulanic acid is a great first-line option because it covers a wide range of bacteria, including those pesky anaerobes.
So it's like a double whammy, taking care of both the aerobic and anaerobic bacteria. What about other options? Our sources mention cephalexin and cefovecin as well.
Those are good options too, especially if we suspect staph or strep involvement. Cefovecin is especially convenient because it's a long-acting injection. That could be a lifesaver if you've got a feisty cat or an owner who might have trouble giving pills.
Convenience is definitely a plus. Now, how long do we need to keep these furry patients on antibiotics?
The general rule is at least 5 to 7 days after the abscess has resolved. But to be honest, it really depends on the individual case. Some might need a shorter course, while others, especially those with deeper infections or complications, might need antibiotics for several weeks.
So monitoring is essential. And speaking of monitoring, what about pain management? These abscesses can be pretty painful.
Oh, absolutely. Pain management is so important, not just for the cat's comfort, but also for their recovery. A cat in pain is less likely to eat, move around, and heal properly.
What are some effective pain relief options for these patients?
NSAIDs, or nonsteroidal anti-inflammatory drugs, are our go-to for pain and inflammation. Meloxicam is a good choice for cats. It's generally safe and effective. But always remember to double-check those dosages and be mindful of potential side effects.
Safety first, of course. Are there any other pain relief strategies you like to use?
Yeah, opioids like buprenorphine can be helpful in really painful cases or after surgery. And don't forget about supportive care. A warm, comfy environment, soft bedding, and easy access to food and water can do wonders.
It's all about the holistic approach. But even with the best treatment, some cats just seem prone to developing these abscesses. Is there anything we can do to reduce the risk of recurrence?
Prevention is always better than cure. And honestly, one of the best things you can do is keep cats indoors. It drastically reduces their exposure to other cats and those potential bite wounds.
That makes sense. But what about those owners who are adamant about letting their cats roam free?
I get it. Some cats are just adventurers at heart. In those cases, I always recommend spaying or neutering. It not only helps with population control, but also reduces those territorial instincts and aggression that often lead to fights.
So it's not just about preventing unwanted kittens, it's about behavior modification as well. But even with altered cats, there's still a chance they could get into a scuffle. What else can we advise owners to do?
Education is key. Encourage owners to check their cats regularly for any signs of injury, especially after they've been outdoors. Look for those puncture wounds, even if they seem small, and any swelling, redness, or discharge should warrant a trip to the vet.
Early detection is crucial. The sooner we catch those abscesses, the better.
Absolutely. And don't forget about vaccinations. Keeping those core vaccines up to date, especially rabies, is always a good idea.
So we've covered a lot of ground today. Bacteria, clinical signs, diagnosis, and treatment. But it all comes down to prompt recognition, aggressive treatment, and proactive prevention.
Couldn't have said it better myself.
Now, even though cat bite abscesses are incredibly common, I think every case presents its own unique challenges. Is there anything you've learned over the years, something you didn't necessarily learn in textbooks or research papers that only experience could teach you?
That's a great question. I think one of the biggest things I've learned is to trust your gut feeling. Sometimes there are these subtle cues, like a hunch you get from the cat's demeanor or the way the owner describes things, that can be just as important as all the diagnostic data.
It's like that sixth sense you develop after years of working with these animals.
Exactly. You start to recognize patterns, pick up on the little things, and sometimes even anticipate problems before they happen.
So much of veterinary medicine is about experience and observation. As we wrap up this deep dive, what are some key takeaways you want our listeners to remember about cat bite abscesses?
Well, for me, the biggest takeaway is that even though they're common, we should never take them lightly. We need to approach them with vigilance, knowledge, and compassion.
Vigilance to catch those early signs, knowledge to use the right tools and treatments, and compassion to guide both our patients and their owners through the process.
Exactly. It's about understanding what we're dealing with, respecting the potential for complications, and doing everything we can to ensure a good outcome for every cat that comes into our care.
And it's not just about treating the immediate abscess, it's about educating owners about prevention and those all-important follow-up appointments.
Every interaction we have with owners is a chance to advocate for our patients and help them make the best decisions for their cat's health.
And speaking of resources, don't forget that you can find all the show notes, including links to the source material we've discussed, on our website. It's packed with information to help you dive even deeper into this topic.
It's like your own personal guide to cat bite abscesses.
So to all our awesome veterinary clinicians out there, keep up the amazing work, stay curious, and keep those tails wagging.
And until next time, happy healing.